Good afternoon. I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There'll be group pictures at the start and end of the pep talk, so please show your face in the video. Reminder, after the pep talk, please take the online learning code evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this. The link has been placed in the chat box. Another reminder, obtaining 25 or latest certificates will entitle one mentee to a voucher for a free ROJoson medical consultation, either face-to-face or telemedical. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. Thank you. So let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please show your face in the video. Ready? Ready? 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021 during the COVID-19 pandemic. There are 3 courses in the pep talk. I completed the core course as shown here on October 9, 2021. And then from October 2023, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer depending on our enthusiasm, discipline, and perseverance. But to tell you honestly, we're now on our 3rd year. Okay. We'll be completing the 3rd year on May 15, 2024. My pep talk today is entitled, Can One Skip Radioactive Iodine Therapy in Thyroid Cancer Treatment? The empowerment objective is for the lay people to have an essential understanding on whether one can skip radioactive iodine therapy in thyroid cancer treatment as part of their health management. The contents of this particular pep talk will be the following. What is radioactive iodine therapy, or RAIT? How is RAIT used in thyroid cancer treatment? And the question is, can one skip RAIT in thyroid cancer treatment? A disclaimer, my pep talk will contain my thoughts, perceptions, opinions, and recommendations culled from my personal experiences as well as from other professionals. Let's start with the first topic. What is radioactive iodine therapy, or RAIT? Radioactive iodine therapy has been used in the treatment of thyroid cancer since the early 1940s. But the questions are, what is it? How does it work? Which patients need it? And how has its use changed over the years? And then the last question is, can one skip RAIT in thyroid cancer treatment? Radioactive iodine therapy is categorized as a drug, and it's a special drug that has radioactive substances. That's why it's called radiopharmaceutical. As radiopharmaceutical, they are drugs that contain, among other ingredients, radioactive forms of the chemicals called radioisotopes. This is a radioactive substance. So radioactive iodine as a radiopharmaceutical involves the use of a particular radioactive isotope, which is called the iodine 131 or I-131. Okay. So this shows the usual commercial package of a radioactive iodine. Okay. So there's a caution sign of a telling people that this contains radioactive material. Iodine 131 is commonly used to treat hyperthyroidism and certain types of thyroid cancers, usually papillary and follicular. So at the moment, the two most common indications in the use of iodine 131 is in patients with hyperthyroidism and in patients with papillary and follicular thyroid cancers. How is RAIT used in thyroid treatment? Dito tayo magpo-focus sa thyroid cancer treatment, not hyperthyroidism. There are 4 common types of thyroid cancers, which are the papillary thyroid cancer, follicular thyroid cancer, medullary thyroid cancer, and anaplastic thyroid cancers. So, ang naka-categorize as well-differentiated are the papillary and follicular, and the undifferentiated are usually the anaplastic carcinomas, and some of them will be under medullary thyroid carcinoma. RAIT is only used for well-differentiated thyroid carcinomas, specifically yung type na tinatawag na papillary, follicular thyroid cancers. So, medullary anaplastic carcinomas will not benefit from RAIT. That's why it's not being used for these 2 kinds of cancer. So, ginagamit lang ang RAIT sa papillary and follicular thyroid cancers. Well-differentiated thyroid malignancies, such as the papillary and follicular, retain the ability to absorb iodine, thus radioactive iodine, that can destroy the cancer cells, making RAIT an effective therapeutic interventions. Usually, pinapatay ng sodium iodide 131 yung mga cells doon sa the normal thyroid cells, pinapatay rin, plus the cancer cells. Through the so-called, this is an radioactive emissions, okay, beta emissions, it's a special type. So common indications for RAIT in well-differentiated thyroid cancers being done in the community. So ito yung pinaka-commonly used sa community natin. One is remnant ablation. I will explain this one by one. Adjuvant therapy, and then treatment of known disease. Okay. Let's start with remnant ablation. Pag sinabi mong remnant ablation, this refers to the destruction of the remaining or presumably benign thyroid tissues remaining after a subtotal or total thyroidectomy. So, minsan may ginagawa tinatawag total thyroidectomy pero may naiiwan pa rin. No? More so with subtotal thyroidectomy, so hindi tinanggal lahat for one reason or another. No? Tapos yung natitira, isusunog, i-ablate with the RAIT. So remnant ablation promotes accurate interpretation of the post-operative RAI whole body scan, imaging, and serum thyroglobulin levels. These are the usual tests being done after for thyroid cancers. Okay. Usually after a total thyroidectomy para maganda yung labas, magandang mga imaging studies. So to have an accurate interpretation, so mitigating confusion between what may be residual remnant of the thyroid tissue, local disease recurrence, or metastatic disease. So yung remnant ablation is just to facilitate accurate interpretation of the mga scanning procedures and blood type, blood test, no, serum thyroglobulin levels, no, para hindi lang ma-confuse. Kasi kung merong uptake, ang tinatanong, is this part of the thyroid cancer or normal lang siya? No? Adjuvant therapy naman, the other use for RAIT is adjuvant treatment. When you say adjuvant treatment is additional, pandagdag, additional therapy after surgery. The reason for this would be to lower the risk for cancer recurrence in patients with an intermediate or high risk for recurrence. So yung mga may high risk for recurrence, na let's say ginawa ng total thyroidectomy, bibigyan ng RAIT. This is, ang purpose, ang goals nito is to decrease the risk of recurrence. Okay? Kung meron mang natitira. It is claimed that adjuvant therapy improves the progression-free survival in patients with no obvious evidence of disease but the possible presence of subclinical micrometastases. Baka merong malilit yan, hindi lang nakikita, kaya dinadagdagan yung RAIT para habulin sila doon kung saan man siya, kung nasaan siya man. No? Okay. So adjuvant means dagdag dun sa thyroid surgery. Usually total thyroid surgery, total thyroidectomy. Yung buong thyroid tinatanggal, then binibigyan ng RAI therapy as additional treatment para to cover yung mga hindi nakikitang mga cancer that might be present. Now, the last indications for RAIT in thyroid cancer treatment is the treatment of known disease, meaning yung nakikita natin, may natitirang bukol na cancer. Okay. So this is yung mga destroying known residual. Known means documented, meron talagang residual, may natitira, or yung mga umuulit, recurrent, structural or biochemical diseases. So this shall be done in both curative and palliative intent. Kung curative means matatanggal lahat, no? Palliative, baka to be realistic about it, baka hindi na matanggal lahat, kaya lang binibigyan pa rin itong RAI therapy para mag-improve lang, baka para mapahaba lang yung buhay ng pasyente. No? So this therapy is said to improve the progression-free and overall survival. How is RAIT given? Paano binibigay ito? Iodine 131 is supplied in capsule or liquid form for patients to swallow. So, merong capsule, merong liquid. It is quickly absorbed into the bloodstream in the gastrointestinal tract. It is concentrated from the blood by the thyroid gland. Yung thyroid gland ang nagko-concentrate ng iodine 131. Kaya importante, dapat mawala. Kung bibigyan mang RAI treatment, dapat wala na yung thyroid gland para hindi na pupunta sa thyroid gland at pupunta na lang doon sa mga cancer cells. No? But let's say, uminom yung pasyente ng RAI na may thyroid gland pa siya, may remaining thyroid gland, okay? Then it will destroy the thyroid gland, yung mga normal thyroid gland cells. No? But it can also kill cancer cells that may be present in the neck or elsewhere. Pero importante, mapatay mo na yung mga cells sa thyroid gland. Kaya usually this is given after a total thyroidectomy. Now, hospital confinement is usually needed to isolate the patient under RAIT. As I said, kasi may radioactive substance yung gamot na yun. No? And the duration of stay averages 3 to 4 days, sometimes 2, depending sa dosage. No? Depends, so it all depends on how quickly the RAI, not RAI, mali ito, RAI leaves the body. So what are the side effects of radioactive iodine therapy? Number 1, hypothyroidism. As I mentioned, sinusunog yung thyroid cells, no, yung normal as well as abnormal one. Kung sinunog yung normal na thyroid cells, so the patient will end up to have hypothyroidism kasi nasunog na. And usually it's permanent. No? Then the other side effect will be neck swelling and tenderness, masakit, nausea, napapasuka, swollen salivary glands, loss of taste or taste change, dry mouth or insufficient salivary production, dry eyes, an excessive tearing up from the eyes. Now, what precautions should be taken with radioactive iodine therapy? Women who are pregnant or nursing should not receive RAI therapy because of the radioactive substance there. Pregnancy should be delayed for at least 6 to 12 months after RAI therapy for thyroid cancer. Breastfeeding should be stopped at least 6 weeks before the RAI and should not be resumed. Makapunta yung mga radioactive substance sa baby. In the days immediately following your RAI therapy, be aware of the general precautions to prevent radioactive exposure to other people. Number one, avoid prolonged close physical contact with other people, especially children and pregnant women. Kasi pag na-expose yung mga bata at other pregnant women, now you can have development of thyroid cancer in the future for the children, and pregnant women naman, baka may magkaroon complication ng pregnancy niya. So for the first few days, stay at a distance of at least 6 feet away from others. Parang COVID, no? 6 feet away. Avoid public places. Sleep alone in a separate bed or at least 6 feet away from another adult. So may kasama ka sa kwarto. Do not share kitchen and cooking utensils, bedding, towels, personal items with others. Parang infection control regimen din ito, no? Okay. Do the dishwashing and laundering of the items you use separately. Wash your hands as often as you can and then shower daily. Okay, if you have received radioactive iodine and you're going home, okay. Now, what are the expenses of RAIT in the Philippines? So it will be dependent on the cost of yung iodine 131 itself. So, and then this is dependent on the dosage, kung ilan ang bibigay, 50, 150, 200 millicuries, etc. And then how long you will stay in the hospital. Kung 2 days, mas lesser an expense. Kung 4 days, mas malaki ang expense. And of course, the professional fee of the doctors. Okay? Now, the other things to consider will be kung meron kang field health or without field health. Usually, may konting benefit from field health ito, yung RAI. Then whether you have senior discount or PWD discount. Okay? The average in 2020, ewan ko lang kung ngayon, kung nagbago, I hope mas mura, baka tumaas pa, mga 50,000, no? But wala pa yung mga discount, no? Okay. So this just shows yung sakop ng you have benefits from PhilHealth, no? Okay. So pag yung low dose, usually you have benefit of 2,800 pesos. And then for the high dose one, with metastasis, you have a benefit of 5,500. So ito nakikita niyo yung dosage, no? Kung ang 151 to 200 ang dosage, mas mahal ang presyo ng RAI compared to, let's say, 21 to 25, mga 5,000 lang dito. Now, the most important question in this pep talk will be, can one skip RAIT in thyroid cancer treatment? So the reason why I came out with this topic, so this is the context of the health issue that we're discussing now, because a lot of physicians are recommending RAI in the treatment of thyroid cancer in a ritualistic and maximalist approach. When I say ritualistic, parang force of habit, parang reflex na lang without critical analysis, basta merong papillary, thyroid cancer, follicular cancer, after the operation, kailangan mag-RAI. No? Lahat, binibigyan. Maximalist naman are those people, those doctors who think that it will benefit the patient. No? Pero it might turn out not to be necessary. And minimalist will be thinking baka yung kailangan lang. Kung di kailangan, wag na. No? So the most ideal one is to look for a minimalist approach. No? Yung kailangan lang. So that's why you have this question, can one skip RAIT in thyroid cancer treatment? Now, before I go to the answer, direct answer to the question, can you skip? Now, here is a history of the use of RAIT. It has evolved over the year. So a decade ago, so this was written in 2021. So a decade ago means 2011, ganon, 10 years ago. RAIT is given to everybody, halos lahat ng pasyente na merong thyroid cancer, no, papillary follicular, binibigyan. Okay. Even someone with the smallest, yung pinakamaliit na papillary cancer, kasi papillary cancer can come in various sizes, in various stages. No? So, but review of the data shows that not all patients, hindi lahat ng pasyente kailangan nun ng RAIT. There may be no need to treat all thyroid cancers, okay, as most grow slowly, and patients have excellent outcomes with surgery alone. Okay? So kung saan, pwede ng operasyon na lang, no? Pwede na yun, no? So now there's the leaning more towards giving less radioactive iodine therapy and doing less aggressive surgeries, particularly if there is a very low risk for recurrence, and one may recommend only a partial thyroidectomy in not very aggressive surgery, or removal or part of someone's thyroid gland, and not to give them radioactive iodine at all. So this is the background of the issue here. Can one skip RAIT in thyroid cancer treatment? Okay. So this background gives us a leeway, baka pwedeng hindi. No? So we have to look at the indications. So one can skip RAIT in thyroid cancer treatment in this condition if the risk for recurrence after surgery is low. Mababa ang risk of recurrence. No? Wala naman such thing as zero risk, pero mababa ang risk for recurrence, then you can skip RAIT. No? So this is seen in those if there is complete removal of the well-differentiated thyroid cancer during surgery. Basta kompleto yung pagtanggal, malinis ang pagtanggal, and there's a low risk of recurrence, then you don't need RAIT. Okay? You observe lang, i-monitor na lang, no? For life. No? Now, one should not skip. Okay. The other side of the coin, one should not skip RAIT in thyroid cancer. One, if the risk of recurrence after surgery is high, such as meron siyang natitira incomplete removal, no? Okay. Then, number two, meron na siyang may kumalat na at the time of surgery, okay? Distant recurrence, distant metastasis, no? Okay. Pwedeng pumunta sa lungs, pupunta sa bones, yung mga distant recurrence, distant metastasis ng thyroid cancer, even with papillary and follicular. Pero bihira lang yan. Number three indication, there is a recurrence na opera na umulit, na either local means sa neck, or sa ibang lugar na distant recurrence, no? And then kung local man, after the surgery, kasi kung local, pwede pa rin tanggalin ng operasyon, no? Kung natanggal sa operasyon, maliit lang chance of recurrence, then you don't need your RAIT. But if there is a high chance of recurrence o baka may naiwan pa, then there is that indication to give RAIT. Okay. So to repeat, one should not skip RAIT in those with a high risk for recurrence after surgery. There is a distant metastasis. There is a recurrence as a rule. But titingnan pa rin, may exception kung may low chance of recurrence kasi binalikan, tinanggal, at mas maganda ipagtanggal. So low chance of recurrence. Then you don't have to give your RAIT. So, and a word on the common practice of remnant ablation using RAIT. This is commonly practiced in the Philippines as well as elsewhere. No? So this is my stand. Okay, but I'll define first what is remnant ablation. Okay, so it refers to the destruction of the normal thyroid tissues remaining after a total thyroidectomy, a subtotal, that was done for thyroid cancer. So let's say may thyroid cancer on one lobe, tinanggal lang yan, subtotal means tinanggal lang yung thyroid cancer in one lobe, may natitirang thyroid tissues, normal thyroid tissues on the other lobe, no? So you can, a lot of physicians use RAIT to burn the remaining thyroid tissues. No, okay, grossly normal naman sila, pero gusto nila tanggalin para mapadali yung mga studies that will be done thereafter. Okay? So the implications is that grossly the thyroid cancers have been removed completely. Iba yung usapan yung di natanggal lahat, no? Pero ito, in this particular instance, natanggal na lahat yung mga nakikita, no? Nakakapa, no? Okay. Pero yung operasyon is not a total thyroidectomy, kaya may naiiwan na normal thyroid tissues na konti, no? Konti lang naman, no? Okay. Subtotal lang yung natitira, no? So binibigay yung tinatawag na remnant ablation by a lot of physicians. As I said, to facilitate yung studies. Okay. So remnant ablation will just be done to promote the accurate interpretation of the studies like post-operative RAI, whole body scanning, serum thyroglobulin levels. So to facilitate, just to avoid the confusion, kasi mahirap mag-interpret na, no? Kung nagpa-RAI scan, no? Or serum thyroglobulin, may mga levels, may mga findings, mahirap i-differentiate whether ito ba ay residual remnant na thyroid tissue, no? Na normal, or it's a local disease, recurrence, or metastatic disease. Okay. So ginagawa lang ito, but a lot of physicians are doing this. As much as possible, ang gusto nila, total thyroidectomy. Kung di na total, susunogin nila yung natitirang thyroid tissues with RAIT. So personally, my personal practice, my personal belief, my personal TPOR, thoughts, perceptions, opinion, recommendation, I don't go for remnant ablation of the normal thyroid tissues using RAIT just to facilitate interpretation of the studies. Okay, so but note, this is the situation in which the assumption is that there is complete, natanggal ko lahat, complete removal of the well-differentiated thyroid cancer even after a subtotal. Yung ibang mga cancer naman, hindi siya involved in two lobes, so pwedeng subtotal lang. So this is one of the indications that one can skip RAIT in thyroid cancer treatment. So, summary and takeaway, I have discussed the following. What is radioactive iodine therapy? What is RAIT in thyroid cancer treatment? And can one skip RAIT in thyroid cancer treatment? Takeaway in relation to patient empowerment, be always in touch with reliable medical information on whether one can skip radioactive iodine therapy in thyroid cancer treatment. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment, kaalaman, kakayanan, karapatan, kapangyarihan to gain greater control over decisions and make better decisions on whether one can skip radioactive iodine therapy in thyroid cancer treatment as part of your health management. This ends my pep talk today. Can one skip radioactive iodine therapy in thyroid cancer treatment? I hope I have empowered you to have an essential understanding of whether one can skip radioactive iodine therapy in thyroid cancer treatment as part of your health management. Before we go to the question and answer portion, reminder, please take the online Learning Room Evaluation Test exercise for mastery of learning and have a perfect score to get a certificate like this. The link is already in the chat box. As another reminder, obtaining 25 OLETE certificates, okay, I have decreased this from 50 Now it's 25 starting 2024. 2025 Olete certificates is enough to entitle one mentee to a voucher for a ROJoson telemedical consultation, either face-to-face or telemedical. Feedback to this pep talk, please type in your feedback in the chat box during the open forum and before we adjourn. Now let's now have a group picture taking before we start the question and answer and interaction. Please show your beautiful faces in the video. Okay, ready? 1, 2, 3. Okay. The floor is now open for questions, suggestions, sharing of experiences, and consultation, a short consultation. Okay. Any questions? We still have 30 minutes. Okay. Any comments on the use of RAI?
Susan.
Oh, Susan.
Yes. I had radioactive therapy because of my thyroid, and I had to my thyroid gland was totally removed. Okay. It was a quick decision by my doctor. By my doctor apparently, and there was no discussion anymore. No, kasi I think it's in the paper that we signed before operation that the doctor is free to decide something like that. No, so anyway, it was it was a long operation, 6 hours. It was done at Manila Medical, and then after that, the following day, my doctor asked me to speak. Of course, he wanted to know whether I have voice. I understand that those who undergo this kind of operation may lose their voice. Fortunately, I didn't lose my voice. Kaya lang, bumaba ng a few decibels. I used to sing well. Now, no more. So what is my question? Now that I heard your discussion, could it have been that I should have only, part of my thyroid gland should have only be removed and not all? And isn't it that our thyroid gland, the use of our thyroid gland is for, ano ba to? Immunity? Ano ba yon? I'm not so sure of that though.
Metabolism.
Metabolism, sorry. Metabolism, immunity. Yeah, metabolism. So, I'm now trying to recall were the things that I felt after that ano ba yan, that affected my metabolism. Okay. Fast forward. After that, I had RAIT at Manila Doctors. I was confined there for 4 days. All you discuss about, I went through, no? And everything. So I went home, but they got my the clothes that labor burn daw nila something. All the precautions were told to me. But after that, parang wala naman din akong na-feel na adverse effect. Tama ba yon? Or
Okay.
I still had to undergo, by the way, I still had to undergo after how many weeks? Total body scan. Just to be sure na wala ng cancer. So yun ang aking sharing, yun ang aking mga question for you.
Okay. Thank you for sharing. Number one, okay, your question is whether total, subtotal, it all depends, no? Uh, Number one, what is the type of thyroid cancer that you have? Papillary, right?
Yes, papillary.
Papillary. Number two, did it involve the two lobes, two major lobes? Kasi may right and left lobe. Can you recall?
Hindi ko na ma-recall. Pero
Okay.
apparently, if it was total removal of the thyroid gland, apparently it might have involved the two lobes.
Hindi. There are two lobes of the thyroid gland, the right and the left, no? Yung major, ha? Yung malaki, ha? And then, thyroid can affect one side lang or two side, no? Two lobes, no? So if the two lobes are involved, no? It's not practically no discussion. Ito total na, no? Kasi two lobes, di ba? Okay. So tatanggalin yung buo, no? But if only one lobe is involved, there's some discussion there, no? Okay. I mean, there's no 100% na agreement on what to do, no, by the mga expert, no. Some would just do yung subtotal, meaning just removing once the lobe that is involved with the thyroid cancer, usually papillary follicular, and then that's one. The other approach is under subtotal is one lobe is totally removed, yung mayroong thyroid cancer, plus kukuha sila ng kapiraso, isa subtotal nila dun sa kabilang side, na? Okay? Kabilang side. So, ibig sabihin, practically 1.5 or 1 3/4 tinanggal, na? Okay? So yon, no? So, I don't know yung sa iyo, kung ano yung involved, one side or two sides, no? You cannot recall, no? Okay. But if one side is involved also, there's some surgeons, some experts would go for total thyroidectomy, no? Okay. So as I said, may mga disagreement pa dito, no? Okay, what to do? If one lobe is involved, may mga disagreement on whether to do total or subtotal, no? Okay? Okay. So I hope I answered that one o yung first issue mo, okay? The second issue is RAI therapy, okay? So you underwent a total thyroidectomy, no? And then somebody suggested to you undergo a RAI therapy, no?
The doctor, yeah.
As I said, dalawang sitwasyon yon, no? Number one, kung natanggal lahat, you don't have to go for RAI therapy because there are some patients who didn't have to go for RAI therapy after a total thyroidectomy, no? Okay. But if there is a residual, may konting naiwan, no? Okay. So the doctor will suggest you take RAI therapy, no? Okay. Of course, the other yung mga tinatawag na may mga disagreement on the approaches, natanggal na lahat, but despite that, pinibigay ng RAI therapy, no? So as I said, this could be a result of yung mga ritualistic physicians or maximalist physicians, no? Okay. But if you are a minimalist physician, you might opt for just observe without RAI therapy, no? Okay? So the assumption is natanggal lahat, 'di ba? Okay. Pag may naiwan, no issue, you have to get the RAI therapy, no? Okay. Okay?
Mukhang yung doktor na that was in 1998, Doc, mukhang siya radical ang mga niya. So, sige, without explaining everything to me, bata pa rin naman ako noon at saka nagtatrabaho in a hurry for ganyan. So go ahead, do it. And I was on leave naman for 1 month. So I was observing myself. Ano kaya ang mararamdaman ko? Although, yung nga sabi niya pag ganyan, good news and bad news, sabi niya. yung good news, yung thyroid cancer, yan daw yun ang the least fatal, sabi niya pa ganyan sa akin. Yung bad
Papillary.
news, cancer. Is
Ah,
that true?
kasi yung cancer is a dreaded word, di ba?
Yeah.
But there are different types of cancer. Pag sinabi mong papillary sa thyroid, when you say papillary, it's the best cancer. Kaya good news,
Oh,
di ba? Compared
ah,
to anaplastic, compared to medullary, the other types, no? Okay.
yeah.
So the
ah,
best cancer to have, if you have to have cancer of the thyroid gland, still papillary. Now, majority will have a good prognosis. Majority, not all, no? Not all.
yes.
So the next one will be follicular, no? Ganon. Okay.
Okay, thank you, Doc.
Okay. So let me add a comment to your mga sharing. You have um you have to discuss it with your patient, with your doctors, no? No.
Wala na siya. I don't see him anymore after 20 years.
Hindi, before, at that time, no? That's why we have this
Noon.
patient empowerment program, no? So you have the rights to discuss, no? Doesn't mean that the doctor will decide for you, no? Okay. They will always ask you, they should tell you first what are the pros and cons, what are the recommendations and pros and cons, and then ask you what do you want, no? Okay. So,
Mukhang hindi
gan,
naman ganun ang naging discussion namin. Kasi
kaya,
I was already afraid. O sige, whatever, whatever is the best, do it.
okay. Ayan, baka you trusted him already. That's it. That's part of the,
Yes.
okay.
Oo. Yun
Uh,
ang nangyari. Oh.
but try to develop that practice of trying for in the future for all of us, no, if you have any medical conditions, ask, okay? Ask the doctors, no? Okay? Until to help you make a decision. So in the end, it should be yung sinasabi mong magsa-sign ka, no? You don't have to sign if you think you don't like it. Okay? But if you sign it, that means you agree on it. Diba? Okay?
Okay. Thank you. Yes, thank you.
Okay.
There's a question from Terry Antabigne.
Uh-uh.
Doc, what if breastfeeding ka before the treatment, Doc? Do I need to pump and dump my breast milk frequently during the treatment para ma-lessen yung chance na ma-expose yung breast tissue ko sa radiation and maiwasan ang possible breast cancer? May fear po kasi ako since may history din po kami ng breast cancer at hindi po na-follow yung guideline dapat 6 weeks na stop breastfeeding before the treatment.
Let me study the questions na mahaba, ano? What if the breastfeeding before the treatment, doc? You need to pump. Now, during the treatment, huwag ka na magpapa-breastfeed. When you say you don't breastfeed, you don't use the milk na from your body. No? Okay, that's what it's meant. No? Kasi yung body mo na-expose na sa radioactive iodine. No? So yung mga radiation, yung radioisotopes, yung mga substances might contaminate your breast milk already. No? Kaya sinasabi sa ang recommendation, no, you stop your breastfeeding already. Actually, breastfeeding plus the breast milk. No? Okay. I hope that clarifies things, Cherry. No? Okay. So kung let's say magpapa-RAI ka, nagpapa-RAI ka na ngayon, you stop the breastfeeding completely. No? Okay. Huwag ka na
Yes.
magpa-breastfeed. Huwag ka mag-ipon ng milk for your baby kasi contaminated na 'yon. No? Okay.
Opo, Doc. I mean po, Doc, is since contaminated po yung breast milk ng radiation, kailangan po bang frequent yung pagpapump and dump I mean yung pump and dump po is yung ipapump mo then itatapon, ganun po,
Yeah,
Doc?
yeah, pwede mo itapon yon.
Or just let it na
Itapon mo.
mag-stay or hindi mo na ipapump?
You can,
Ay, itapon na po. Sige po.
let it run sa natural course, no? So, wag mo nang ipump para tumigil na rin kasi kung ipapump mo,
Tumigil.
milk lalabas pa, di ba? Okay.
Opo.
Kasi
Hindi naman po siya risky, Doc.
hindi naman, the intention is to not to feed the baby anymore. Okay? When you are
Yes po.
undergoing radiation. Ang takot mo ba is kasi hindi I'm trying to see kung baka ini-imply mo if you don't do the breast pumping, baka tataas ang incidence naman ng breast cancer. Ganun ba?
Yes po, yun po yung
Hindi.
fear
Hindi yan
kapag expose sa
hindi yan.
tissue.
I don't think it has been shown that if you do that, now it will increase your risk for breast cancer. No? Okay.
Okay po.
Okay. Okay? Meron pa ba?
Nothing at the chat box.
Ako, Dok, may tanong.
Oh, Kat.
Kasi ako naka-skip ako talaga ng ano, di ba po, ng RAI.
Ah,
Kasi ano ko, low risk. Ask ko lang, yung cousin ko kasi, bumalik sa kanya, total thyroidectomy. Pagkatapos, RII siya uli. Sa ultrasound tsaka sa thyroglobin niya, may nakita pa yata uli po.
bumalik
Apo, bumalik po.
na total thyroidectomy siya, na RAI na siya. No?
Yes po.
Kailan bumalik?
Nagpa-check up siya ngayong bumalik siya ng PGH. Kinuwento niya sa akin kahapon, tawag dito, may nakita pa daw uli na 4 na bukol yata uli. Tapos sa thyroglobin niya, ano po, yun nga po, mataas po, pinakita niya sa akin.
Okay. So, pwede mangyari yon. Kaya sinasabi ko nga rin sa lahat na yung if you give your RAI, there's no guarantee it will totally prevent a recurrence. No? Okay. So, walang total guarantee. But we just have to choose which one will be the best approach. Yung minimalist or maximalist. No? Okay. So, meron din mga pasyente hindi nagpa-RAI, no? Naka 30 years, no? Sino bang nag-RAI dito? Wala, no? Wala, sayang di nakapag-attend sila, ano? Yung mga iba, si Aida Antonio, if you have heard of her, no? Rowena Caballero, no? Marami ako mga pasyente na kahit na may neck node na, hindi ko pa na RAI kasi complete removal ako no? Malinis ang pagtanggal at babantayan ko na lang, no? Si Aida Antonia did not receive RAI despite the fact na may 2 operations siya, no? So one sa neck, sa thyroid, the other one sa neck node, no? Okay. So anyway, giving RAI does not guarantee na hindi siya magre-recur. That's what I'm saying. No? Pwede pa rin mag-recur as exemplified by yung kwento ni Catherine, ni Kat Espero. No? May nag-recur. O nag-recur, mapipilitan ka magbigay ulit ng RAI kung di mo matatanggal. No? Okay. So pag may nag-recur, kaya importante yung check-up. Kung mag-recur, let's say nag-recur lang dito sa leeg at pwede pang tanggalin na lang. Mas ano. Okay. Surgery is still the best treatment.
Sure na yun, Dok, kasi nga, pangalawa niya na, sure na yun na matatanggal na. Hindi pa rin. Sure na yun na pangalawang RAI niya na matatanggal na yung cancer sa katawan niya.
Oh, no guarantee. Number one, nasaan ba yung recurrence niya? Baka yung recurrence niya sa malalim, malayo. No? Saan ba yung
Okay.
recurrence niya? Baka yung recurrence niya nasa buto, sa lungs.
Sa
No?
thyroid daw po uli, bumalik. Sabi ko, di ba ano ka na, total ka na? Sa thyroglobin daw kasi niya nakikita, meron pa rin daw. Tsaka sa ultrasound daw nakita sa leeg.
Sa leeg lang.
Yes
leeg.
po, Dok. Sa leeg, sa ultrasound nakita.
Baka hindi siya nakakapa ba? Importante rin kinakapa ng doktor eh, no? Kasi pag
Hindi ko sure, Dok, kasi nire-refer ko nga sa'yo, kaso nga gusto pa rin niya sa PGH eh.
yan, okay. Kasi pag nagpa-scan ka, radioactive total body scan, mayroong mga lumalabas na maitim, no? Yung mga parang uptake, no? No? Pag may uptake, hindi ibig sabihin na cancer niyon, no? Baka may naiwan pa noon. Naiwan na thyroid tissue, no? Okay. So hindi totally it doesn't totally mean na may recurrence. So importante kapain yung leg niya. Kung wala kang makakapa, no, at meron nakita sa scan, baka hindi talagang recurrence, no?
Okay.
Okay. So importante makita ng isang espesyalista ng thyroid also, no? Kinakapa, no? Kasi yung mga lab test like total body scan, minsan inaccurate din yon. Okay. Did I answer your question, Kat?
Yes po, Dok. Thank you.
So number 1, no guarantee, it will not recur. Number 2, don't rely completely dun sa scan, sa mga lab test, no? Dapat ibabangga mo sa mga sa kapa-kapa, no? Okay? Okay? Any more questions?
Wala na po. Thank you po, Dok.
Any more? Wala nang sharing of experiences except for Susan with thyroid.
That's more.
Okay. Sharing. Okay. So if there are no more questions, we'll call it a day. Wala nang no? I hope I have answered yung mga concerns ninyo, no? Basta tandaan ninyo, anything that we do may dapat i-justify, i-justify, and dapat alam niyo yung explanation ng mga pros and cons, no? Okay, then come out with a decision, no? Okay?
Doc, may isang ano lang ako tanong.
Sure. Aloy.
Si Marian Rose Bailo tong dito sa Hong Kong.
Oh.
Out of topic na po ito. Ano po, gusto ko po sanang magpa-check up online, teleconsult.
Pwede.
Paano po?
Pwede. I-PM mo na lang ako, bigyan kita ng
Sige po.
I-PM mo ako, na bigyan kita ng time.
Sige po.
Okay?
Sige.
Okay? PM mo, alam mo na yung Rinaldo ROJoson, di ba?
Parang naka-follow ako doon. Sige, i-search ko. Tapos mag-message ako doon. Thank you po.
Okay. So, any more on the topic? Wala na? So, yung mga issues na dinidiscuss ko, these are observed, no, na-observe ko na pwedeng kailangan na enlighten yung public, no? Okay. Okay, if there are no more questions, we'll call it a day, no? We'll see each other next week again, no? Baka, yung Holy Saturday, wala tayo. Pero next week, meron pa, no? Okay. 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 Bye-bye.
Thank you po. Thank you.
Thank you po.
Bye-bye.